Hi, I'm Dr. Bill Adams, and this is No Spin Live, everybody's favorite program where you get the hot topics in plastic surgery discussed by the world's top plastic surgeons. Today, we're going to be covering breast implants and the UFC, Dr. Miami, a shocker, and finally, patient confusion over the real Botox doc. So with me today, we've got two great plastic surgeons, Cliff Clark from Winter Park, Florida. Cliff, thanks for coming.
Thanks for having me, Bill.
And Dan Del Vecchio from Boston, Massachusetts. He is actually in New York City at the time. Dan?
How you doing, Bill?
Good, boys. Well, listen, let's get into it. Let's just start in this thing. The New York SAC, which is the New York State Athletic Commission, just pulled a fighter. Her name is Pearl Gonzalez from the card this past Saturday at one day before the fight because she has breast implants. And they said that in New York, there's a rule that fighters can't have breast implants. And so they said she was not going to be allowed to fight. This is the first time that's happened in the UFC. And it's kind of interesting. Cliff, what's your take on that?
Well, you know, the conclusion is not based on any science. We don't have any data that would suggest that blunt trauma to the chest with an implant is going to cause any long-term damage. What they should look at is more consistently at the brain. Now, that has a lot more issues for them. But we've taken care of all breast trauma. We've taken care of gunshot wounds, stab wounds, motor vehicle accidents, and you know, you take the implant out and you replace it. So I saw the rule in their bylaws. I don't think it's there for any scientifically based reason, however. And certainly to do it at the last minute makes absolutely no sense.
Dan Del Vecchio, what was your read?
Well, Bill, you know, New York, for all its, it's the financial capital of the world, but it's still a really, really conservative state. It's got a lot of old, quirky laws. And this law probably has nothing to do with breast implants. This law has probably to do with people having, plates and screws in their hands to give them some unfair advantage. If anything, having breast implants gives you a disadvantage because, to throw a punch, you need your serratus, your pec. If the implants are under the muscle, I don't see how this helps her at all. So I think this is just an old law covering all implanted things in a patient, and I think that this has nothing to do with breast implants per se.
We know it's interesting. There was some reports probably a year ago talking about how breast implants have saved lives in terms of people being stabbed and shot and crazy things like that. But in some ways, having a breast implant might give them some added protection. But certainly, as Cliff said, no scientific information that would lead you to believe it's dangerous for her to fight. And in fact, the current implants are incredibly durable. BJ is going to show a clip here of a car running over a breast implant and it's fine. So yeah, it seems a little bit archaic. Seems like it's bad timing too, the day before the fight. Too bad for Pearl, and we hope she gets back. I guess she should probably just not fight in New York anymore. Just go to Vegas. Vegas is better anyway, don't you guys think?
Yeah, it's inconsistent with the laws in other states. California, Nevada, plenty of fighters have had breast implants in other states, but their last-minute reversal would suggest they're rethinking that law.
Well, either that or she just recently dated, one of the fight organizers.
Yeah, well, whatever it is, I'm going to be cheering for her next time because she got kind of got the shaft in this one. But anyway, let's move on. Hey, we're going to go back to this is from your neck of the woods, Cliff. This is Dr. Miami from South Florida. You're in more in Central Florida, I know, but he apparently has some really interesting age requirements for his patients, and they said how he's a renowned surgeon, Snapchat king, but he doesn't operate on anybody over 50.
Well, it's shocking, really. Firstly, it's just overt age discrimination. I think that it's crazy. Maybe it's because I'm 57 now. I might be a little bit more sensitive to these issues. But, it's clear that this gentleman has a very internet-driven practice. He has a lot of younger fans. He does a lot of breast and body-related things. And, I think if you go further in his article to see how he tries to make things safe and have people appropriate for his outpatient surgery center, there is some logic to it, but 50 is an arbitrary thing, and if he's worried about people having heart disease, high blood pressure, whatever the disease might be. That's why we rely upon our colleagues in cardiology and family practice to make sure that they're safe for outpatient surgery. Clearly doesn't do facelifts and eyelids because that's the demographic of that age group.
Del Vecchio, what say you?
Well, a couple of issues. One is he's got the right to operate on whoever he wants and not. And I don't think it's necessarily age discrimination. But I do agree it's kind of strange. Secondly, you know, we always have to make the distinction between cosmetic surgery that's age-related and cosmetic surgery that has nothing to do with age. And if you think about rhinoplasty, buttock augmentation, breast augmentation, those are typically operations we do that have nothing to do with age. They have to do with somebody wanting something shaped differently. And as Cliff said, eyelids and facelift patients are different patients. They're typically older. They have a lifetime of experiences, often baggage. They come to you because their ex-spouse is getting married and their child's getting married. The ex-spouse is dating a 25-year-old. They want to look good. It's a completely different set of circumstances. Dr. Miami's practice is a younger practice, and you know, it's totally his right to do that, although it is a little strange. I would also tell you that there are a lot more women I'm seeing who are over 50 who want their butts done. So, hey, good for him. Have those 50-year-old butts come my way.
The happiest patient I've ever had in my practice is an 82-year-old woman who came in for breast augmentation, and I was a little shocked. Got her very cleared, but listen, my hat's off to her. She's a happy lady.
Yeah, I'm not sure you can go by road age, but I see in the article, you know, that if you're operating in your office-based OR, you know, sometimes people do have more stringent rules. But I would argue that there's 55-year-olds that are physiologically a 25-year-old, and there's also 40-year-olds that are like 75-year-olds. So it's tough to make this the rote things, but I guess everybody's entitled to do practice as they see works best for them. So. All right, well, let's go on to this last story. This was actually an interesting article. It was talking about people talking about who the real Botox doc is, because they're talking about cosmetic dermatologists who are doing injectable fillers, that sort of thing, and then obviously plastic surgeons that are also doing that. What do you think, Cliff? I mean, what do you tell patients, or what should patients know about the two disciplines, because they both do it, but there are certainly differences in training, and what do you think?
You know, I have a tremendous working relationship with the dermatologists in my community and both nationally. They do a tremendous job, and I respect their training. Obviously, they have a much better insight into skin function and physiology. I have a better insight into facial anatomy as it goes deeper, and certainly into the surgical realm. And you know, I think that we've gotten along really good with dermatologists for a long time, and both of our messages has been to go to a core trained board certified physician for these types of things. And so, you know, I don't think that there's really an argument as to who does it better. I just think that there's a lot of people who emphasize cosmetic improvement in the face, and there's many plastic surgeons do an awesome job, as are a number of dermatologists. So, you know, I think that's an argument that is not really going anywhere.
Dan DeVecchio, what do you think about this topic?
Well, I mean, I agree with Cliff. First of all, in a lot of practices, the physician doesn't even do the injecting; it's the nurse. So the real question might be: is a nurse in a dermatologist's office better qualified than a nurse in a plastic surgeon's office? And the answer is that's ridiculously no. There's no difference. So I agree. I don't see what the issue is. This is a much ado about nothing. Dermatologists probably do more injections of things than we do anyway in the office for acne and cysts and everything else. So if you're just talking about dexterity with a needle, they probably do it more than we do anyway.
Yeah, you know, I mean, I think both disciplines certainly have that core training, which is important. And this kind of stuff, injectables, there's all sorts of people doing injectables, hairdressers, you know, people who don't even have a medical license, frankly. So it's just not, certainly those two disciplines probably have the most expertise. But if you're going to have an injectable done, you got to make sure just like anything else, make sure you're going to somebody, just because they're cosmetic dermatologist or a plastic surgeon doesn't mean that they have expertise in it. They certainly have the training, so you got to do your homework. But I would agree. I think a lot of the cosmetic dermatologists I know that are really good at that. I've actually learned quite a bit from them, as I have from plastic surgeons. And you just got to do your homework if you're a patient and wanting to have stuff done.
You know, that's the lesson for me is through the years on the podium and through various scientific endeavors, I've learned a lot from dermatologists, and I would dare to say they've learned a lot from me. We have different training, but we have the different desire to have outstanding and safe patient outcomes. And so that's a group I feel very comfortable with. I think is the point that you've raised. There's a lot of people out there who don't have the training, who don't have the insight, and probably shouldn't be injecting. And you named the spectrum of dentists, family practice docs, and you can have a little Botox from those kinds of people, and that works decent. But when it comes to injecting around the eyelid or some of the more sophisticated injectable techniques that we use, I would submit that they are very poorly prepared for the potential issues that can arise.
Yeah, well, that's really great info. Guys, appreciate you guys' time today. It's been great. I think that there's been some really good pearls you guys have given our viewers, and I'm sure they're going to appreciate it too. And if you want to see more of this, you can see it at theplasticsurgerychannel.com.